Yinspired is dedicated to all the grandmothers and aunties whose voices weren't heard or listened to, and created for the daughters. Aloha and welcome back to Yinspired, a podcast celebrating different perspectives in Chinese medicine and integrative medicine. I am your host, Dr. Haunani Chong-Drake, a doctor of acupuncture and Chinese medicine. I am very excited to introduce today's guest to the pod, Dr. Jennifer Serjana, a doctor of acupuncture and Chinese medicine. Welcome, Jennifer. Thank you so much for being here and sharing space with me today.
Thank you for having me. Very excited to talk to you today.
I just want to let the listeners know, I just met you, 2 years ago now? Yeah, when I moved back to Virginia. This is our third time moving to Virginia. And I met Jennifer while we were working together. I had just joined the Acupuncture Society of Virginia, which is Virginia's only professional organization for licensed acupuncturists. And Jennifer has been our guide, our leader, and I am so thrilled to call her a friend and colleague now. I have just always been so inspired, obviously, by your clinical success and the patient outcomes you are getting in women's health. But more importantly, what stands out to me as a colleague and friend is your professionalism, your boundaries, and your leadership. So thank you so much.
It's hard to believe it's been 2 years, actually. It's one of those things that goes by so fast and I guess slow in other ways. But yeah, working together in ASVA has been really great and getting to know you.
Thank you. Yeah, I honestly never thought I'd get into policy or anything like this. And It has been actually quite a joy and probably a big reason why this podcast even exists. So It's all connected. I'm going to make sure to share your full bio in the show notes, but in your own words, so our audience gets to know you a little bit about how you got to where you are today. Could introduce yourself to our listeners.
Yeah, absolutely. So I am Dr. Jennifer Surjana. I have been practicing Chinese medicine for about 20 years now, which is crazy. I have a clinic in Norfolk, Virginia called Source Fertility. I am a fertility specialist and, practicing within the realm of traditional Chinese medicine and kind of a functional health lens, bringing in modern medicine and diagnostics and kind of coupling that with the ancient medicine of Chinese medicine. I also have a virtual program called Infinite Fertility, and that allows me to work with women all over the world on kind of the same root method that I use in the clinic, but bringing it out to the world virtually.
I'm so excited to get more into your specialty, into women's health. I know that your perspective, having such a unique niche or specialization, gives you an insider's lens to a broad spectrum of topics that I think even general licensed acupuncturists and people in healthcare in general might not know or see. And I think that's where both of you and I discuss where we really like to take this conversation. Before we get there, I'm really curious. This has just been one of my favorite questions to ask our guests is, what was your relationship with medicine or other forms of medicine growing up? And how did that inform where you are today?
Oh, that's an interesting question. I mean, I don't know that I had much of a relationship with medicine growing up. My parents, is a pretty kind of conventional going to the doctor for annual checkups and things like that, and going to see a physician if we had a fever or got sick. And that was about it. I don't actually even know how this came to be, but I did develop a real interest in plants and herbology and kind of like high school age. I can look back and go, oh, that's kind of where my interest started. But I don't know what drew me to that. I don't think it was anything in my childhood. It certainly could have been that I haven't recognized just yet. But I never saw myself falling into East Asian medicine. Like I just never saw myself falling into any type of medicine. And I did.
That's so fascinating. If it wasn't on your radar, and I assume I'm making an assumption here, you grew up in the United States, correct?
I did.
Yeah. So at what point does, East Asian medicine or acupuncture school, and maybe you can tell us where you went to as well, how does that come into the picture of growing up or becoming an adult, or at what stage?
Yeah, it was definitely in adulthood. So it was after my undergrad, I moved out to New Mexico and lived really on in just north of Santa Fe in a place called Powake on an Indian reservation. And I just kind of living my life. My undergrad was in fine arts, and I took on the role of directing an art program in a private school in Santa Fe. And along the way, my first year living there, I had a studio in my backyard where I painted, and was painting one night, kind of in the middle of the night, and got this pain in my ovarian area. Didn't really know what was going on at the time, but really sharp pain. Didn't know what to do. It was kind of scary because up to that point, I had never really had anything significant in my health to deal with, certainly not without being under my parents' care. Ended up taking myself to the emergency room and was diagnosed there as being totally fine. And was given some ibuprofen, like extra strength ibuprofen, and told to just kind of go home and wait for the pain to pass. And I took a couple days off work because it was so significant. And when I started feeling better, I went back into work. And the parent of one of my students was studying acupuncture. He was an acupuncture student, and he approached me and kind of asked what was going on, why I had been out of work. And when I told him, he just invited me to come and try acupuncture. So that was my entry into the world of Chinese medicine. And he's really a big reason why I chose this path. I just became really fascinated by my experience with him, with the herbs. Definitely. He burned moxa. He did like all of the great stuff. And I was just in awe of what was happening. And I could feel the changes in my body almost immediately. And so that was a really powerful moment for me. And I started borrowing his books and asking questions. And about a year and a half later is when I enrolled in school and started down the path.
Wow. Yeah,
Yeah.
this is not uncommon, is to hear a health challenge that kind of directs you towards the path of medicine if someone wasn't already on the path of medicine. So yeah, thank you for sharing that.
Yeah.
And so a year and a half, in that time, you're just reading the books and you're still being an art teacher. And
I was working, and then I moved up to Colorado, up to Denver, and spent that was probably about a year of exploring what I wanted to do in life, kind of trying to find myself. And that's when I got very into meditation. I actually created a whole room of my house just for meditation, and meditated every day, probably spent an hour or two in that room. And that was how I figured out really that I wanted to go into Chinese medicine. And once that realization hit me, it was kind of like one of those things like, why didn't I think of this months ago? And I immediately called the school that was in Denver, which is the Colorado School of Traditional Chinese Medicine, and enrolled. I think classes were starting 2 weeks later, and that was it.
oh my gosh, I love it. I can really resonate with that. And
yeah, it's like I feel like I assume you can agree to this. I feel like it chose me versus me choosing it, which is very strange, but very real.
yeah, those are the exact same words I use. I feel like it chose me. And then weirdly enough, once school started, I realized I had grown up with Chinese medicine my entire life. I just didn't know that's what it was, because
Amazing.
that's just what was around the house. I think, oh, I knew I was going to do this all along. I didn't know. Like I knew and I didn't know.
Yeah. That's very cool.
Yeah. You said you've been in practice for nearly 20 years. You have a fertility clinic. And you are very, very clear that it is a fertility clinic. And as I have pointed out to many of my students, if they were to look at your website, it doesn't even say acupuncture or Chinese medicine or East Asian medicine or functional medicine or integrative medicine. None of those keywords are really on your website. And I am so fascinated by that.
Yeah. Well, I think for a lot of people out there, when they're experiencing pain or disharmony in their bodies, they want to be healed, but they don't necessarily know what they're looking for. So they don't know, like I'm looking for an acupuncturist or an herbalist or a functional medicine doctor, whatever it is. They don't know what they're looking for. So the steps I have taken in my practice is I don't think my patients care what I do. I think they care how I do it, and I think they care that it works. And so that's what I advertise. That's what I want people to know, that we have, an 87% success rate, which is, we're very proud of, which is crazy high. We want people to know that this medicine works and that it's holistic and it's medication free. And we do advertise those things, but we don't talk about exactly what we're doing. I think that, the consciousness of society, I think, is shifting, and people are searching out more natural ways to live and certainly to heal themselves too. But it's kind of in baby steps. And if you don't know, you don't know. So I think it's important for certainly for my clinic and what I do, and something like fertility, which is rapidly changing and affecting more and more people every year. And, the stats just keep changing. I think that offering something that is, advertised as something that will help and will work. And then, like I say, they can come in and kind of figure out if it's the right step for them.
Yeah, I'm really curious about that, what you just said about the landscape of the fertility journey has changed over the 20 years.
Yeah.
How would you describe that? Or maybe first off, when you got out of school, did you jump right into fertility and women's health, or how did?
Yeah, not fertility. Fertility kind of fell into my practice, and it started as a women's health practice, and really a prenatal health practice. That's kind of where my first real love was, kind of coming into
Mm,
this medicine and into private practice. And from there, it just organically became, some past patients that I had seen me for their first pregnancies were then having trouble with their second and started coming back in to see me again for help. Part of it was positioning, just being in a neighborhood of the right demographic and people knowing that I did prenatal and kind of calling in and saying, "Hey, do you do fertility work?" And I lived my first practice was in Oregon and Portland, but then I moved to DC, the DC area. And when I practiced there, things really shifted. I think the general demographic really shifted. And my fertility work became the first thing that I was doing, and prenatal work secondarily to that. And that's still very much what it is. I mean, I do have good relationships with OBs and midwives and generally see my patients all the way through pregnancy and into postpartum. And I love that work too. But yeah, at this point, the practice is fertility focused.
so when you say over the last 20 years or 15 years, what does the landscape look like? What did it look like? How has it changed? What are you seeing
Yes.
now?
So I can say that, now the World Health Organization stat for infertility is 1 in 6. So 1 in 6.
That high?
That's right. Yeah.
Is this
And
female or female and male?
I believe it's across the board. Yeah, I think it's couples, 1 in 6
Wow.
couples. Just a few years ago, it was 1 in 8. So this has been within, I don't want to misquote. I want to say it was in the last 5 to 8 years, it was at 1 in 8. So it's been a very short amount of time that it's changed. And prior to that, I don't know the stat, but easily searchable. It's all out there. It's interesting. Infertility rates are on the rise, but so are general women's health issues. Endometriosis is something that we see a lot more of clinically.
Oh, yes.
PCOS,
Yes.
just things that are left undiagnosed. Because I think that's one of the things about women's health is that it's treated more as like a side medicine, a niche, and really it shouldn't be, because it's foundational to our society and our communities and our lives. But often women go undiagnosed or ignored for so long until the problem becomes so loud that it's finally screaming. And at this point, then we're kind of finding that these diagnoses are rising. So how many, undiagnosed or ignored women are out there with conditions as well that aren't even documented currently? So,
Absolutely.
but yeah, I think across the board, women's health needs to be considered more. It needs to be proactively treated versus reactively. I mean, I know our medicine, not our medicine, but the conventional medical system is reactive. And really, we're not treating a problem or considering it until it is a diagnosed problem. We're certainly not preventatively treating women or the general population. And if we were, we would likely be in a very different place than we are.
This is so obvious, but approximately 50% of the population is born female and has reproductive capability. And the fact that it's considered a specialty or niche
Yeah.
is kind of mind blowing to me.
Yeah,
It's like, wait a minute, we're talking half the population is considered a specialty or niche. This
totally.
isn't just like everyday medicine.
Well, it's wild. And when you think that women are the ones that carry and birth these babies and our infertility rates are rising so drastically, this affects the future population. I mean, this is something that if you're not experiencing infertility, I think you have no idea. You have no idea what is really going on. And you don't know that, there are questions that I believe we need to be asking, and things that we need to be looking at. And how is our environment affecting us? And how are our choices impacting us? And the rapid changes that we're making in our lives, how is that impacting our health on a level that literally can change everything for the future of our population?
And I'm kind of speechless right now, which you know me is very rare. But I'm just sitting here letting it soak in. Right. I guess it's never occurred to me that my general medical practitioners, my physician, my MD, the people I went to, even growing up, that they may actually not have had any education or background or knowledge even about basic women's health or hormonal health, or, that my dysmenorrhea or my painful menstrual cramps that I started very early on, to the point where I took myself, not me, but had someone take me to the ER twice, was not normal, because I was just told, no, this is normal. You're just
Totally.
this is just what happens. Now looking back, I see, one, that probably wasn't the best care I received, but it obviously was normalized, because what I was told is, oh, this is normal. And so how many other people were they saying that to?
Yeah, a lot. This is something that I see in practice all the time. I mean, again, it's one of those things where if you don't have an issue that needs to be looked at, something that is interfering with your life, certainly fertility is a big one, but if you don't have symptoms that are loud enough to really make you pause and go, no, something is not right here,
Right.
you accept everything as just being normal for a woman. Like, a woman is supposed to have a painful cycle that's very heavy, or like just whatever it is. We as women believe that our experience is the normal one, and we don't generally question that or look for ways to treat that or manage that. Again, I do think that women are beginning to start asking more questions. They're beginning to say, no, don't just give me a pill. Like, let's try to treat what's going on. But it's really a long time coming. Like, we don't know.
Yeah,
We don't
and can
know.
we talk about this though? Because I still hear it. I see it on social medias and I hear it all the time, that people say that having a painful period, dysmenorrhea, is absolutely normal, and you just got to suck it up and put some whatever they were told, ice on it or heat on it, or go take your ibuprofen and you'll be fine. But let's talk about this, because I know we have a different education.
Yeah.
We see that as your body's giving you a message, and any type of pain, even if someone has told you that that's quote unquote normal, from a different paradigm of medicine, any pain is a message telling us to pay attention, that this is not normal or physiological. If you're having pain, you're in a path of pathophysiology or pathology or out of balance or disease, or whatever the paradigm. So can we talk about this a little bit? Because I know people listening, we have everything from students in medicine to just listeners, people who consider themselves part of healthcare, either from a certified place or from a licensed place, and kind of everyone in between. But can we maybe have this uncomfortable conversation about
Yeah.
something so basic like period pain?
Yeah. Well, I would say it starts with accept the truth that, if your body is balanced, your hormones are regulated, if you're in a good place when it comes to health, then your period will be asymptomatic. You will just bleed. That's it. End of story. There's nothing else. That's it. And if you're not experiencing that, if that's not your experience, then you should be asking questions. I think it's that simple.
And what happens when they say, well, welcome to, puberty, suck it up, buttercup, this is normal? Where do you keep asking questions then? Where do you go?
That's when you seek out a provider that looks at things differently. There's a lot of us out there. It takes a minute to not just go down the easiest road and go to, whoever your health insurance covers or whatever. But there are knowledgeable, successful practitioners out there that can offer you help, and you can live a life that is not painful. You can live,
Yeah.
you can have periods that are just periods that don't interfere with your life in any way.
Yeah.
Yeah.
I hope more people consider that, because I still hear so many people, like I heard this a lot actually. I was a guest teacher at a yoga and Ayurveda focused retreat. And so many of the people in that retreat said, well, I heard that having a painful period is nature's way of preparing me for childbirth. And my jaw dropped. I was like, where did we hear this? Where did we learn this? And at the same time, I could understand how easy it would be to convince myself of the same thing.
Yeah.
So how do we get the message out? Pain is pain
Yeah.
is pain.
Yeah, we talk more about it. We have the
Yeah.
conversations, we have the podcasts that get the information out there so people can hear it. But really, it needs to be normalized. It needs to be, our culture does not normalize it right now. We ignore
Normalize
it. I
talking
mean,
about pain or normalize talking about menstruation? All of it.
menstruation, probably all of it, to be honest. But my wheelhouse is certainly the women's health part. And I think that most mothers don't know what to teach their daughters because they haven't been taught anything. And again, I mean, the population that I deal with are women who have been experiencing infertility. A lot of them have irregular cycles. They have other things going on within the realm of women's health. And as we begin care, when I ask them about their period, I mean, I still have women that come in that don't know how to answer the questions. They're not paying close enough attention to their periods to really know how heavy it is or how many days they're bleeding. They're maybe keeping track of things in an app and they're like tracking and forgetting. And there's just a real disconnect that is happening, that I think has been happening for a very long time, for generations. And because the conversations aren't being had, it's very difficult to start the conversations, to start talking about it because we don't know. So when women are finally experiencing major issues with their reproductive health, then they go, oh, whoa, like this isn't normal. This wasn't normal. Like for years it wasn't normal, but I didn't know that. I didn't know. And I really think that the population that I work with are some of the most educated women out there because they've had to dig and figure out for themselves and research because their physicians aren't helping them or not helping them enough. And it's a problem. And I think that having the conversations and normalizing that is the only way to get to a point where it's not, a widespread disconnect.
Okay, so not to put you on the spot, you can say no, pass on this one, but I'm a mom. My daughter is preteen age. We have very open conversations, but for this moment in time, I want you to pretend like I've come to you and I'm like, I don't know what to tell my daughter. She's 10. She hasn't started. Some people in her class in fourth grade have started their menstrual cycle. How do we start having these conversations? If I'm a mom, right? Like if my mom never had that conversation with me, I only had it in school during that 1 hour class every year. How do we begin to demystify, to reduce the shame, to take the embarrassment out? I don't know why people don't have those conversations, but what would you recommend?
Yeah, well,
How do we start?
I think that part of it is going to depend on kind of how the style of parenting, right? So you might have a biological conversation. It might go there, but it doesn't have to. It could be more of a spiritual conversation. There are different ways it can go. There's a lot of really great books and resources. You could pick up a book and share that with your daughter and ask her to encourage her to come to you if she has questions. You should probably read it first and, educate yourself. So you know what's going on and you're able to, have those conversations with her in a way that's helpful. But I think just that, even just that as a bare minimum will change everything because that gives the mother, the daughter, whoever the daughter talks to, that spreads that information out there and people can start talking about it more. Leaving it up to the schools is crazy.
Yeah.
Yeah.
No, I agree.
Yeah.
Okay, I'm going to say something that's probably pretty controversial here. It almost seems, in some ways, by design, that we don't know about our own bodies. This is taboo. We don't bring it up. Maybe it used to be sacred, but somehow it turned to secret. And then from secret, it turned to like shame or guilt or not good or gross. And so by design or not, whether, there's a hand behind it or not, I'm sure we'll get a lot of comments and people both confirming or not. But what I'm going to say is it's quite convenient if half the population doesn't know about their body and therefore is dependent on getting information about their body from other people, especially if those other people don't share the same physical traits. There creates a hierarchy. There creates a dynamic where I no longer know about myself. So if I don't know about the most physical part of myself, I don't know about anything else either, right? It becomes a ripple effect to so many aspects of my own personal life. And then if that's happening systemically, which it has been, that bleeds into the entire culture and society generationally. And that is just both heartbreaking and infuriating.
Agreed. Yeah. And I think part of it may also just be that the male population doesn't understand it, doesn't want to understand it. And that probably trickles down into the care that's being provided by male, physicians who are working with females. I don't know. I don't know how much of it has just kind of over the years and the generations. But yeah, I would agree with you.
Yeah. And I mean, in some ways, if there is an unfamiliarity with that body, and at the same time, in other cultural ways, there's an obsession with the female body, that creates mixed messaging. It creates confusion. It creates when am I allowed to honor it, see it as sacred, see it as normal physiological function? And it creates this mixed message of then also when is it scary or not to be touched or we don't know. Let's not, I mean, honestly, I hear my husband now saying, follow the money trail. Just follow the money trail. You'll get your answer. Obviously, he's not into the room, but I know that that's what he would share right now. And it would be interesting. I have never followed the money trail on this in terms of like women's health, women's reproductive health. Do you know anything or have any stats?
I don't. That is an area that I have not followed either. So I don't know.
Yeah.
No, but
I think it would be really interesting.
It would be. And this is, it's very much the reality of where we are right now in terms of however we've gotten here, we're here. So just figuring out how to get back to the place of knowing and understanding and being comfortable in our own bodies.
I hope we get there sooner than later. We all need it. And it's not just females need it. We all need it. One of my favorite motivating quotes / my why, like why this medicine, why get involved, is I read this quote and I'm going to butcher it. I love quotes and I always butcher them, but it's something like the health of a society, the health of a community is based on the health of the mother and children of that society.
Yeah.
And I remember reading it and like crying and bawling, being like, yes, that feels like a capital T truth. And that's not what I'm seeing. That's not what I'm experiencing.
Yeah, we have to pay more attention. I think it's vital that we pay more attention and that, again, that we proactively see women and their health as something more important, something that we shouldn't be ignoring. The symptoms that women have and experience with their reproductive health are just the signals of something underlying going on that's bigger and more seriously looked at and figured out and develop ways to work with that. So as you said, kind of the women can be healed and the whole culture can be healed.
It's for everyone's best interest that there's more balance, there's more harmony, there's more attention, more money put into women's health.
Yeah.
I think about if the amount of pain that I was going through menstruating for most of my life, if that had happened to a male at that age going through medical school, I'm pretty sure a drug would have been found and studied immediately. You know what I mean?
Things would have been figured out real quick. Yeah.
And I can't help but know that to be partly true. And some people say, well, that's ibuprofen. But I'll be honest, ibuprofen did not touch. It did not move the needle on that type of pain that I had. And I know I'm not alone. Hold on. I'm going to pull up. I just wrote this stat down because I was mind blown. So hold on. I have to pull it up because I want to read it to you. Okay. I was listening to the podcast, The Drive by Peter Attia. Are you familiar with?
I'm not. No, I'll have to check it out.
He had a guest. This is one of the most recent episodes. Dr. Rachel Rubin is an MD. She's board certified urologist and one of the nation's foremost experts in sexual health. I actually paused the podcast, sat down and typed it out because I was like, this needs to be in writing. It's not just something floating in the ethers. Okay. So they were talking about entire generations of doctors not being trained in hormonal health and especially in hormonal health prescribing. So into reproductive health, female hormone tracking, that whole realm of medicine. And she said, the data is very clear on this. Less than 6% of internal medicine, OBGYN, or family practice doctors get even an hour of menopause education in their training.
Did you say 6%?
Less than 6%.
6%.
6. 1, 2, 3, 4, 5, 6. Less than 6% get an hour of menopause education in their training. And then they went on, Dr. Attia and Dr. Rubin went on to talk about how when they went through school, which was probably 20 years ago, they received probably 0 hours.
Whoa.
Yeah. And just a few hours here or there about general reproductive health.
That's crazy. That's crazy.
Yeah.
What are we doing?
What are we, so to our point, and it's no one's fault, right? Like I always aim to take shame and blame out of conversations because I don't think it's helpful. But to know those type of things does bring a broader picture to the experiences we might be having, and also point the finger to where there are gaps and why aren't these gaps being filled? Or maybe they are being filled. I know you filled one of those gaps for your community. I actually focus more on pain, but even within pain, women's pelvic pain, back pain, knee pain, frozen shoulder,
Yeah.
fibromyalgia,
Yep.
right? These are all conditions, especially frozen shoulder, fibromyalgia, endometriosis, PCOS. These are pain conditions that afflict female bodies statistically way more than male bodies. And yet there's very little options.
Yeah. Well, I mean, I think it's true. The gaps are being filled. There's not enough people out there filling them. We could be doing a lot more than we are. But for the communities that have the resources, that are able to look into a type of doctor that has maybe a different lens, a different perspective, that can be extremely valuable. And to your point, especially when it comes to hormonal health. But I'm sure across the board, we just need to do more. I mean, there needs to be more out there. So I had mentioned in the beginning that I have a virtual program for fertility. The reason that I started this was because of people asking it. So the area that I live in the country is very transient. We have a lot of military families that come through, and I'll have people come into my practice and they're not able to be there very long and they'll be going somewhere else and they'll ask me who they can see there. And sometimes there's nobody, it can be very difficult to find someone. Or sometimes I would get patients that would ask for their family or friends in other places. And it just became a struggle for me to find resources for them. And so some places it's easy, but a lot of places it's not easy. And, I've been kind of saying that the future of everything is virtual, including healthcare. And here we are kind of being able to expand our wings and treat people really from anywhere in the world. But I think that one thing that technology has brought us where we are today is the ability to do that. So even if you're in an area that doesn't have that physical resource for you, you can look on the internet and see if you can find someone who is able to work with you and offer you a solution to the issues you're having, and probably offer you a solution to issues that you don't even know you're having yet, because your body's not screaming at you just yet. It's whispering maybe, but not screaming.
And that's a good point. Let's talk about some things that might be whispers that we're overlooking, but also some things might be screaming at us, like period pain, and we've been told to think about it as a whisper. So what are some of those whispers?
Gosh, this is such a good question. I think, in from a Chinese medical viewpoint, it's so specific to the individual, right? Because it can be different from person to person. But I would say if there's anything that you are experiencing, that a woman is experiencing in her day to day, that she's just kind of, brushing aside as just something that she experiences, that's not a big deal. It's something that I see a lot clinically is headaches or low back pain or trouble sleeping. Right. And you just kind of ignore it. You get used to it and you live with it. Sometimes, I'm sure, Hanani, you've experienced this as well. Sometimes patients will come in and ask them, okay, what else is going on? What symptoms? It kind of go through the list. And then maybe we're seeing them, have been working with them for a while. And is anything going on? And it's nothing, nothing, nothing. And then suddenly, either you ask specifically and it's like, oh yeah, no, I get that all the time. Or it's, oh my gosh, my back pain is gone. And you're like, wait a minute, you didn't tell me you were having back pain. Well, I never thought about it until it's gone and I don't feel it now. And now I realize I had it all the time. So it's sometimes not very obvious. I would say that those are some whispers, the symptoms that are easily just kind of, filed away as something that we can just live with and it's not that big of a deal. I think that it's easy to believe that if it were something that we really needed to take a look at, if it were something serious with our health going on, that it would be more than this. It would be louder than this. So yeah, the key is don't wait until it's loud. If you have anything that's going on that's distracting from your life, you should look a little deeper into it and see if it might be a sign of something bigger.
Yeah, especially because some medical paradigms like Chinese medicine begin to see pathology earlier on, right? Those little whispers, if I'm going to use that terminology now, I've never used it, but like those little whispers, the occasional headaches that are starting to increase in frequency. My sleep is slightly off, but it's still manageable. All of those are little whispers saying, wait a minute, something's shifting here, something's not quite right.
Mhm.
And we can push through it, we can go through it. We often ignore it because we're told to ignore it, and or family or culture. There's so many reasons why we might ignore it. However, over time, those little whispers, they all add up. The headache here, the sleep there, the bloating there, that right knee pain that you never had an accident on, but for some reason it just always seems to hurt,
Yeah.
right? They start to add up. And for us, it creates a pattern that we're looking at, and we begin to see it as a whole picture. How are they all interacting? But for someone who doesn't see their body that way, who hasn't been shown this, it's very, very easy to overlook.
Yeah. What can be really helpful, and I certainly encourage people to do this, is to keep it kind of like, heard of like keeping a food diary, keep a symptom diary. I have women in my practice chart their temperature each day. And it's kind of like, just write down symptoms that you're having too, because we don't know if they're cyclical if we're not tracking them, right? We don't know if they're speaking louder unless we're tracking them. And so if you recognize that you're having something, you had a headache today, just jot it down. And then the next time you have a headache, write it down again. And you can see, maybe you don't know that you're having them every 3 days. You thought that you were having them once a month, or like, who knows? But I think that when we start to keep track of the information, we can either see patterns, which is really fascinating and very common when it comes to hormonal health. So for women, you can sometimes see those patterns related to your cycle. And disharmony with hormones causes all kinds of symptoms, even symptoms that you would think are unrelated to your hormones. But just keeping track of those symptoms can help you realize what is more common than you're recognizing. And that can become a reason to look deeper.
I love that idea because it has become trendy, I've heard, at William and Mary with the younger crowd, young adults, is, or at least for some of the people, they track their menstrual cycles now, right? The apps have made it so easy. It's someone made it trendy. They're doing it. So why not just add those extra notes,
Yes.
in the note section, the symptom tracker?
Absolutely. And let me just say this, since you brought up the apps, because this is something that I think is worth saying. If you're tracking with an app, it's totally fine, but don't let your app tell you what is normal or what you should be expecting. When the app is telling you your ovulation window is happening, it's very often incorrect. When it's telling you should have your cycles, if they're not falling within that time, or if they are, it doesn't mean that your cycle is regulated or dysregulated. So it's really important, like, use it as a tracking, as something that's easy to keep track, but don't use it as a predictor of anything.
I had no idea the apps did that.
Yeah.
I've tracked mine on an app, but only for the calendar. Some apps will actually give you advice, like give you,
A lot of apps give you
really?
advice. Oh, yes. Oh, yes.
I had no idea. Do we know
Yeah.
who's behind that? Like, is it AI generated advice or is there an actual healthcare provider on the other side?
I'm
We don't
doubting that
know.
there is a healthcare provider on the other side, because I find that they are quite misaligned with what actually is going on. I mean, I always thought it was just kind of based on very basic information, like, oh, every woman has a 28-day cycle, which of course is not true. And then we're going to take your last 3 cycles and we're going to take the average of that. And that's when you should expect your period or your ovulation. And that's not true. Like, there's so many variables and factors that need to be considered. But then the advice on top of that, yeah, the apps will give you advice. So anyway, yeah, apps are fine, but just I'd say, outside of just using it as a way to know when your last period was and how many days your period was or whatever, how heavy it was, those sorts of things I think are a valuable way to track in apps. Outside of that, knowing your ovulatory window or when to expect your period or any advice on top of that, no.
Yeah. Just
Yeah,
track it, let the professionals look
absolutely.
at it and
Yeah.
interpret it. That's very good advice. On this note, this is kind of a tangent, but I think this is a really good opportunity to just point out that reproductive health information, also known as your RHI, is protected under HIPAA, right? People need to know that. I
Absolutely.
want people listening to this to know that the same HIPAA guidelines that protect your healthcare information include your reproductive health information. So no one should be asking for it except need to know people. So all you listeners
Exactly.
out there, with that said, this kind of bleeds into the to the app conversation, and that apps are not HIPAA compliant.
Yes.
Right? So if you're using it, you need to know that they're not protected. They're not end to end encrypted, protected health information, even though that information is by law can be protected. If you're choosing to use one of those apps, it's not protected. So use those apps discerningly and wisely, and knowing your beliefs and how much information you want people to be able to see about you. They're very open. Okay.
That's a
Every
good point.
state is different right now in terms of how they're using reproductive health information. So if people want it to be very protected, please don't use the apps. Go back to old school paper calendars if you have to. I just had to put that plug in because I've
Yeah,
been looking at this from our, from the state board side, and Virginia has protections in place, but not all states do. So I just wanted to put that plug in.
that's an important one. Yeah.
Yeah. So you mentioned there's a lot of symptoms that are related to hormonal health that we might not think are related to hormones. Can you give us a list or some that you often see, especially as it pertains to fertility?
Yeah. So let me talk through this, because I would say, again, it's so individual to the person that it can look very, very different from one person to another. And I don't want to say something that would be perceived as like definitely being related to hormone health, because it certainly isn't. It really could be any symptoms. For instance, stagnation in the body. The way that stagnation shows up can look very different. Often, if a woman has one type of stasis, so let's say clotting in your period, just very basic blood stagnation, right? If you see blood stagnation, blood clots with your period, then I would say that it's more likely that you will also have other types of stasis in the body. That could be pain anywhere in the body, right? Because a lot of times blood stagnation leads to pain. So that could be headaches, that could be knee pain or shoulder pain or something that you would think couldn't possibly be related to your reproductive health. And it's not necessarily related to your reproductive health, but because your reproductive health is part of your whole body, it's all related. So stasis that shows up in one area can show up in another area and look very different, and could then be linked to whatever is causing that stasis, which is sometimes a hormonal imbalance. It just depends on what's going on. Other ways that stasis shows up commonly that I see in my clinic would be uterine stagnation, like fibroids or polyps or cysts, blocked tubes, endometrial stasis, endometriosis, endometriomas, endometriitis, any type of endometrial tissue stasis, inflammation in the endometrium. Again, if you are, diagnosed with having cysts, you might just want to keep in the back of your mind that it's likely that you're going to maybe run into some other type of stasis that may show up in the uterus or may show up somewhere else in the body. Sometimes for women, we see it as excess weight gain, like weight gain that's difficult to get rid of. So that's one example of how kind of the same root can have many different symptom ways that it shows up in the body. And it sometimes doesn't seem related at all. Sometimes it does seem related. A lot of times with hormone imbalance, again, we'll see things like headaches, I think is pretty common. Sometimes it'll be migraines. Sleep issues can be very common. Temperature changes in the body. This can show up as, cold hands and feet sometimes. It can show up as chills or sweating at various times throughout the day. Just a kind of imbalance in temperature regulation.
What about mental health stuff? Do hormones affect mental health, like anxiety or depression?
Yeah,
Or
absolutely.
yeah.
So that's a big one. Of course, I would say that cortisol levels, of course, we know directly are impacted by the amount of stress you're under. In today's world, women and men and children are under a great deal of stress. And for a lot of women, I would say that the change in stress hormones, we know that cortisol changes impact progesterone, for instance. Cortisol steals from progesterone. We know that adrenal fatigue can interfere with ovulation. So when the body is stressed, when there is a high level of stress or anxiety, when there is something like depression that exists, that can impact hormonal health, and hormonal health can impact the emotional health and mental state as well.
It's the yin and yangs coming together, right?
Absolutely.
Yeah.
And I
Yeah.
think the mental health aspect in my clinic is there's this 3-part approach that I have. It's got physical treatment and then the internal medicine part of things. And then it's the mental health. And I think the mental health, the lack of attention to mental health in our culture is a whole other podcast, but I think that it is so incredibly important when it comes to women's health. So incredibly important. I don't think you can come to full balance in the body as a woman if you ignore the mental health. It's not going to happen.
When you say mental health, do you mean mental, emotional, or separating the two?
I do. I mean, mental, emotional, a whole range of mental health. And again, I mean, like a broken record, but it shows up so differently for so many people that it, for one woman, it can be one thing and another woman, it can be something completely different. But yes, I would say, I mean, mental, emotional.
I bring this up because I see this a lot. And it's so interesting to hear you talk about it in your clinic where you're seeing people for fertility. I have people coming in oftentimes for pain. They don't bring up their anxiety or depression at all, even when I ask about it. But the way I know about it is because in their medications, we see what they're on, and they're on an anxiety or they're on a depression medication. And I'm like, wait a minute. You totally said nothing about this in person, even when I asked about it. And yet I know that you're on an anxiety med or you're on a depression med. And to me, it's again, that normalization. Well, I've been on it for so long, I forgot about it.
Yeah.
And so then I end up having a conversation. Is it working? Are you, does the medication work? They're like, oh, no, my anxiety is still so high. And I'm very confused because maybe it's a personality thing. If I'm taking a medication that's been prescribed to me for a certain condition, and that condition is not getting better, I'm not going to keep filling my body with a chemical that may or may not create different types of balances later on. And yet we're not allowed to talk to people about their prescriptions in a thoughtful way, right? I think that's actually a really good regulation that the prescribing doctor needs to be the one having that conversation. But it's mind-boggling to me how many people are on anxiety and depression medications. And my population I'm seeing these days is 18 to 24. And I would say 80% of them, I don't have actual figures, but 80% of them are on some type of anxiety or depression medication. And I can't help think about the trickle effect, the ripple effect, if we're just medicating this, and there's not other non-medical ways to address these anxieties, these stressors, the depression, that is going to be a potential future client for you.
Absolutely. I'm curious what that percentage out of that demographic, how many of them are women?
I would say the majority.
Yeah. More of that disconnect and, kind of pushing off the complaints and just prescribing a medication to deal with the symptoms or not, as the case may be.
And I hear too, again, once enough people have it, it becomes normal to talk about it. And it's very common to hear just like, well, everyone has anxiety. Or doesn't everyone have depression? All my friends are on medications. And it breaks my heart. Yes, just because more people are on that medication or identify with that particular disease or imbalance or pathology, whatever word you want to give it, doesn't make it normal, does not make it towards health, towards physiology.
Yeah. I think one of my biggest issues when it comes to medications is that they are usually, certainly not always, but almost always in my experience, prescribed as just something that the patient is being put on potentially forever. There's never a course of treatment that's kind of designed with the prescription itself, which is a conversation that I have with my patients, when I'm talking with them about how to kind of manage care moving forward. Many of my patients don't want to be on medication. Certainly in pregnancy, a lot of them are going to have to stop their medication. So it is a conversation that makes sense to have clinically. And my advice is generally to have that conversation with your doctor who wrote the prescription. What's the timeline? What are we looking at here? Because I think that sometimes it can be really helpful to have something for a short amount of time that allows your system to reset, allows the body to do what it needs to do, so then it can really heal, right?
Yeah.
But when something is prescribed, again, and this is almost always, it's prescribed to just kind of be taken forever. What are we really healing here? What are we doing? What's happening?
I've never thought about it this way. That is very telling how some people, they'll take a medication forever without thinking about what's the timeline here? What's the end goal? Or I'm not seeing a change, but I'll still take it. And yet, if they come in to get acupuncture and they say, how many sessions is this going to take? And you say, 2 to 3 months, they're like, oh, you're such a charlatan. Like, what? I'm not going to come see you for 2 months for this thing. It's like, wait, but you've been taking a medication. You're still paying it. And you said it didn't help you. There's just like a disconnect there. And again, I want to be very clear. I love all types of medicine, but I particularly like the medicines that work, right?
Yeah,
so
absolutely.
if it's a pill, hallelujah. If it's a surgery, hallelujah. I don't want people to think like I'm bashing any medicine, because I am a fan of all medicines that work. And I think what we're pointing out here is there are major gaps in female reproductive health. How can we fill those gaps? What's going on? And let's be real about this conversation too. So I just want to say that, because I don't want anyone firing back at me. I can't believe blah, blah, blah. It's not true. I love all medicine. I just particularly like medicine that works.
Yes. So, let's only prescribe what works.
Right? Or prescribe, because that's part of medicine. It's a practice, right? That we're not sure how a body's going to respond to anything, to even acupuncture or herbal medicine or
any of it. Yeah.
Or any of it. So we have to try with trained guidance. But again, if it's not working, let's not keep doing the same thing expecting different results.
Agreed.
Yeah. I'm curious, what is your take on brain fog? Because this is something else I'm hearing more and more of. I'm seeing in young, I remember learning about brain fog being more of something you're going to see later on in life clinically. And again, here I am with a very young population, and so many people have brain fog. Are you seeing brain fog too in your fertility clinic?
I'd say in large amounts. So your question makes me pause and think. I would wonder, like, the first place my mind goes is how much overstimulation plays into that. Just the fact that we're constantly stimulated with technology kind of in our face all the time. And I would say especially for that demographic, right? More so for the younger demographic, it makes sense to me that that overstimulation would then lead to affect mental clarity at some point. So I wonder how much that is contributing. Yeah, that's a really interesting question. I don't see a lot of it in my clinic. Yeah.
Yeah. People are surprised that mental work affects their physical health. For example, if you're studying, if you're learning all day long, or if you're in a career that requires you to do a lot of data analysis, you're crunching the numbers in the head or doing a lot of mental work, that has an effect on your physical health. There's a disconnect there. People are like, oh, no, my brain should just be able to go forever and it won't affect my physical body. That is going to have direct effects on your physical body. And it's mind-blowing to see people not understand that, not grasp that.
Yeah.
Right. And especially if you're burning the candle at both ends, you are just in the head and you're not thinking it's going to affect your physical body and potentially your fertility and your reproductive health. That's a big disconnect. And we need to connect that. We need people to understand that the way they use their head and their brain and their mental capacity is going to affect their reproductive health.
Yeah. It's all about that balance, right? Like the balance needs to come, and we need to be really intentional about our choices. So if you are using your head a lot and you are, very heavy in an academic program or intellectually, you have to create that balance on the other side of that. So bring in more mindset work into your day. So you're having more times of quiet, whether that's, doing something like yoga, or maybe you like meditation, or maybe you pray, or whatever it is for you, reading a book that's not intellectual, maybe reading just an easy read book, something that allows you to really disconnect, turn your brain off a little bit, and just wind down so you can create that balance to all of that intellectual stimulation. Really important.
Yeah, I am always encouraging people to go on a walk or just go out in nature. Like, just get out in nature without any gadgets. Like, no earbuds, no phones, nothing. Just go walk around in the trees or on the grass, whatever you can find that's nature. And just walk. Listen to the birds chirp. Feel the wind on your face. If it's raining, let the rain pour on you. It's just water, it'll dry. But to me, reconnecting with nature in that way is so powerful. And to me, I see it as medicine.
Well, it is. It is. And I think that it needs to be looked at as something that needs to be in your daily routine, right? It can't just be something that you do every once in a while. You need to prioritize it and bring it into your daily routine, just like you do with all of the other things that you prioritize, that minute to slow down. And I tell my patients all the time, because again, mindset's a big part of the prescription that they get from me. It can start literally a minute of sitting on your bed before you get out of it in the morning and just intentionally breathing. Like, it doesn't have to start with an hour meditation. It doesn't need to be that. But if you are consecutive every day of doing that minute of breathing, your body starts to recognize that as a pattern, as a routine, as something that's, if you do it around the same time each day, your cortisol levels will start to drop, your hormones will start to come into balance. The body will re-regulate because of the routine nature of that. They've actually done studies on this with mindfulness-based stress reduction. They've done studies on where they've had groups of people who will meditate like once a week for 30 minutes versus people who will have a short mindful session for like 5 minutes a day. And they found that the ones who were consecutive and routine with it had the better mental state. So it really does make a difference, even in the evidence that we have available to us, that if you can make a routine out of what you're doing, not only will you feel better, but internally your hormone response is going to be more favorable.
It's beautiful to think about how that connects with yin yang and that symbol, how it's round, it's circular, it represents everything we know to be outside of us in terms of the earth is round and the seasons are routine. Like it just connects you back into the rhythmic part of who we are in connection with the rhythms all around us as well.
Oh, yeah. And we are. I mean, humans, if there's one thing that I would say I have found in practice in all of my years of practicing, it is that the body responds to routine. It can respond to and fall into a negative routine just as easily as it can respond and fall into a positive routine. But it likes routine. And there's always a resistance to getting out of that routine. So when you try to incorporate something like mindset work into your daily rhythm now, and you haven't done it before, it's going to feel hard, right? At first, it's going to feel hard until it becomes a routine, because your body needs to leave its old routine and it doesn't want to, because humans really like routine. Yeah.
It's like getting a ball rolling. You have to put way more energy at the beginning,
Yes.
but once it starts rolling,
you're good to
go.
go.
Naturally,
exactly.
Yeah, you're good to go. You just need that extra push at the beginning. I'm going to look for that research, or if you have it,
I can send it to you. Yeah.
Yeah, that would be great to put in the show notes, because I think some people will want to use that for their own clinic work as well. I have a question for you going back to hormones and clinical use of treatment therapies. What is effective, right? You and I know that acupuncture is incredibly beneficial to help regulate the cycle. I've seen it personally and also clinically. Do you also use herbal medicine in your practice? You do?
Huge part.
So you're...
Yeah.
Okay, good.
I probably prescribe herbs more than I do acupuncture.
That's great. Yeah. And there's not a lot of compliancy issues there on it, because their drive and motivation for pregnancy is much higher. How do you see this working?
Yeah, I mean, here's the thing is that when you work with me, the care, the protocol is what it is. If you don't do it, you probably shouldn't expect to get results. If you do it, you can expect to get results. I think that hopefully for most of my patients, there is a high motivation there. I can tell who takes the herbs and who doesn't. I know how long a bottle of herbs lasts. So if patients are coming in and telling me they still have herbs, I know that they're not taking them as regularly as they should be. And I try to factor that into how I prescribe moving forward and what things look like. But I think herbs are so incredibly potent. And when you combine that with acupuncture and other Chinese medical modalities as a whole, then you have a powerhouse. And when it comes to getting couples to a place where they're growing their families, there's no other way. It has to be multifaceted, and herbs are major.
You do also recommend food, dietary, nutrition?
Nutrition, again, that's a non-negotiable in my practice. There's specific nutrition guidelines for each patient. There's the herbal prescriptions, and then there's the course of treatment, whatever that entails when they're coming into the office. On top of that, there's lifestyle changes. There's the mindset work. Are they getting outside every day? Or what's their lifestyle look like in terms of activity levels and bedtime routine and screen time and all of it? We talk about all of it. So yeah,
that's incredible.
It's all important.
Truly holistic.
Truly holistic. And I really think that is why the success rate is so high. I mean, it makes sense. It's like if you change all of these things and you do it with guidance, because, I've been doing this a long time. I'm very good at guiding people. If you do it, everything that I say, it's inevitable that your reproductive health is going to improve, and it's
Yeah.
very likely that you're going to have success in having a child.
And obviously, no one has 100%
No,
success
no,
rate.
and I can't promise that to anyone. Yeah,
Yeah, yeah. I mean, you can have back surgery and still walk away with back
totally.
pains.
Yeah.
Like,
And
yeah,
you like, we never know, like you were saying earlier, we never know how the body's going to respond. So we don't know, but we can give it our best effort.
yeah. I'm thinking back to former clients, and I would tell them if they were coming in for fertility that I don't want them to try to get pregnant for at least 3 months. I'm working, like you said, more whole person.
Uh-huh.
Um, do you have a similar timeline that you tell patients
Well,
or clients? Let's back
yeah.
off from the trying part.
It depends on the patients. For some, absolutely. If there's any, if I have any concern that egg health is poor, uterine health is poor, if I feel like the patient gets pregnant, that it might not be a viable pregnancy, then yes, I will have them pause. Outside of that, I mean, typically the chances of getting pregnant go up after 3 months because that's a folliculogenesis cycle. So from the egg maturity happens over 90 days. So when someone starts working with a fertility specialist or someone who's helping them with their whole body care that's related to their fertility, the work that we start today, for instance, when it comes to egg health, we're not going to see that for 3 cycles out because that egg is not going to be ovulated. So of course, the chances of conception increase drastically after we've at least been working together for a full folliculogenesis cycle. I think that's important to kind of take into account that, really the fruits of our labor are going to come, a few cycles down the road. I do think that often it takes a little bit longer because usually there's, a lot of stuff to kind of work out and figure out. And in my practice, I find that a lot of times the cycle gets a little wonky. Maybe the cycle's not balanced when I start with a woman, and then her second cycle's better, and then her third cycle's like totally not better. And then after that, like, we start to see. And so a lot of the conversations that I'm having with patients are, okay, don't panic. This is something the body does. It's reworking and it's figuring it out and it is responding. Unless we start to see everything going backwards, then we'll have to kind of dig a little deeper and see what's going on. But otherwise, it takes a minute.
And to vocalize that to your patients on the forefront, saying, hey, I've done this enough. I've seen this enough. It could go this way, but I've also seen it go this way. Don't worry if it does. I've got you.
Yeah.
That's really important to let your patients know,
Oh
because
yeah,
otherwise
absolutely.
they might be like, this isn't working. I'm done. But
Totally.
you're just getting to that place where it's just actually about to start to work.
Yes. Yeah.
Yeah. So communicating that is really important.
Really important. Yeah.
Beautiful. Is there anything for people who are healthcare practitioners who maybe they aren't a specialist necessarily in fertility or hormone health? Any general guidelines for us in terms of what to consider that we might not be considering? If there was like a piece of advice or something that we could take away from this conversation that we could start implementing, what would that be?
Gosh, is just to truly consider the whole body. Don't ignore anything that's going on. Truly look at the whole body and treat that. Again, it's inevitable. Like, if you don't know how to treat the uterus, that's okay, because if you do know how to treat the body, the uterine health will improve. It's inevitable. It just works that way. The body's amazing.
You're coming back to like the basics
Yeah.
of what we learned, really.
Right.
It's like if you
Totally.
can just get harmony in the whole thing, it will ripple effect to
Yeah.
the more micro
And
areas.
if you only know one area, even just working with that is going to ripple and impact domino, if you will, everywhere else. So do what you can do, and, believe that if you can make a difference, even a small difference, that can magnify and become bigger.
That's wonderful. Before our conversation, you brought up women's health as being the canary in the coal mine. Is there anything else that you really wanted to say about that we haven't?
Well, I think we have just the point that we can't ignore women's health. We can't put it in its little niche category. It is really important to our entire community health, global health. It's more than just the little subset that it gets. We need to stop ignoring women when they're saying that they have symptoms. Those symptoms matter. And if we want our future generations to be healthy and sustain, we need to take care of everyone, but we need to take care of women, and we need to really look at what's going on and what is driving all of these women's health rates up. I mean, women's health concerns up in terms of frequency rates. We're seeing them go up so much. So I think it's important to look at what's happening and consider ways that we can reverse it. I mean, I think that the body is really resilient. The uterus is very strong. Like, fertility is not fragile. I think that it's easy to look at it that way, especially when you work in the fertility world. It's kind of like, oh gosh, fertility is, so fragile. It's not, but it is very responsive. It responds to what's in our environment. I mean, today, I think we wake up and women will be exposed to, who knows, probably hundreds of toxins in her environment before she even has breakfast. It's just like we're in this constant overload of disharmony that exists in our lives and our bodies, our environments around us. And we need to start addressing these, because when we improve our environment, then our internal health also improves.
Amen. Absolutely. Yeah, because it's global. Our holistic health really is not just about holistic mind, body, medicine. Holistic means our relationship with each other, whole relationship with environment, how we treat the environment.
Absolutely.
And I just want to piggyback and say, based on this conversations we've had and will continue to have, not only on this podcast, but between you and me, is we also can't wait for the money to show up. We can't wait for someone else to be our savior and throw money to research. It starts with these conversations. It starts with talking about menstrual health and reproductive health with your friends and your children, and asking your children's friends' parents if they're talking about it, right? Like at a very grassroots level. Because if we wait for someone else with the money to do it, we're never going to see it. We've already done this.
Yep.
We've seen it for 100 years. It hasn't happened. And as of this week, even less money towards women's health.
Yes.
With all the research grant money that just got stripped. So it really is a grassroots movement. It's reaching out. It's looking outside of the box. It's okay if it's not mainstream. We have to be creative. We have to be willing to be brave and courageous to do this for each other.
It's necessary. Yeah.
It's so necessary. Absolutely. I really, really appreciate you being here and being willing to have this conversation with us.
Absolutely.
I usually do a rapid fire session at the very end. You can say pass to any of the questions, but just a fun way to get to know you outside of this concentrated conversation. Are you open for it?
Let's do it. Yeah.
All right. So first thing that comes to mind, or, take your time. You can also say pass to any of these. All right. First question. What is the best advice you ever received?
Probably off the top of my head, just to be authentically me, not try to impress anyone by being impressive, because it is so much easier to just be yourself. You're always going to have people that are attracted to you and people that aren't. And you have to put out a lot of effort when you're trying to impress all the time. So I was once told that I shouldn't be afraid to say what's on my heart. I should just say it, and it'll impress who it's going to and not who it's not. So I think that's great advice.
Thank you. And I've seen that live in person, especially when we are doing legislative work. It's inspiring for me, but also magnetizing to be around other people like you who do speak from your heart, because it reminds me, it gives me that permission too. If I speak from my heart, then I'm never out of alignment. I can go to sleep with myself at night. Like, there's no regrets.
Yes. Yes.
You definitely mirror that. I'm
Thank
so
you.
glad you said that. All right. Number 2, what's the worst advice you ever received?
Gosh, that one's harder for me. I may have to pass on this one. I don't know if I'm not thinking of anything off the top of my head. I don't know if I don't. Maybe I'm sure I've received bad advice and maybe just not followed it. I don't know. Yeah.
All the advice you never followed is the worst advice. Perfect. Do you consider yourself a morning bird or a night owl?
A morning for sure. Yeah. I wake up at 4:30 in the morning and start my day, and I wouldn't have it any other way at this point in my life, at least.
Next question. What's your favorite food treat?
So my favorite is like really tart blueberries.
Ooh, very specific.
Yes. Blueberries are my favorite food, but I like specifically the tart ones. Yeah.
And what's your favorite tea or beverage?
I like brown rice tea, but the funny thing is all day, every day, I drink hot water. No tea. Well, cold water is stagnating, so I stay away from the ice water, right? But the hot water for me is just really, I don't know that I can go a day without hot. It's just, it just feels really good to drink my hot water. So even when I exercise, my water's hot, which is wild.
All right. Is there a book that changed your life or mindset?
Ooh, there's a lot of them.
Name one, maybe the most recent or one that sticks out.
Oh, gosh, I'm really bad with titles. I'm reading several right now and I love them all. And I wish I don't have anything here with me. This isn't one that I would have said otherwise, but it's sitting here beside me and I am reading it now. And it is very good. It's a business book. It's called 10X is Easier Than 2X. And the whole premise behind it is in like scaling business and building business to go all in 10 times. Like don't mess around with just doing double because you'll only get so far. But for the same effort, if you go in just a little bit more, then you can see the results of that. And it's a really good book. So
I'll put that in the show notes as well. All right, finish the sentence. Be the type of person who
always shows up.
Awesome. Be the type of person who always shows up. What would you do if you weren't doing the current work you're doing today?
I know the answer to this because I've had this conversation. I think I would have a plant shop.
Ooh,
yeah.
Not necessarily like a florist, but a plant shop.
A plant shop. I think I would want cut flowers as well, but I would have a plant shop. I think I would love that. It's just not something I probably did in another lifetime, not something I've done this lifetime.
Well, what's so beautiful about kind of the circular nature of this conversation, you talked about being really drawn to the herbs.
Yes.
And herbal medicine all the way back in high school.
Yes, it's true.
So they talk to you, they connect with you, they're calling you. That's beautiful. And finally, the question I ask everyone, what is your one wish for healthcare?
Healthcare. We need so much help. My one wish for healthcare, I guess, given our conversation today, is that women are seen and heard and treated proactively.
Thank you.
Thank you.
I have the same wish, very much so. Before we leave, where can listeners connect with you or find your work? If they have questions or if they want to reach out and know more about your online programs or your in-person work?
Absolutely. So on Instagram, I'm at Dr. Serjana. My programs are Infinite Fertility, that's infinitefertility.net, and Source Fertility, if you're local here in Norfolk or the Hampton Roads area, it's sourcefertility.com. So yeah, come find me.
Yeah, I will definitely make sure those are in the show notes as well. So it's easier for people to just click and find you. Well, thank you so much, Dr. Serjana. I so appreciate your time. Please subscribe and share this podcast with someone you know or love and help us make positive ripples in our communities. If you would like to continue this conversation or would like to know more about Yinspired, read the transcript of today's show and find all the resources and links discussed in today's episode, please subscribe to this podcast feed at substack.com/Yinspired. It is free to join and you'll be emailed with every new episode along with the ability to comment and continue this conversation started here for free. From my heart to yours, create a day you love. This podcast is for entertainment, education, and inspirational purposes only. Nothing in this podcast is diagnostic or direct medical advice and does not establish a practitioner-patient relationship. Seek care from a highly trained medical provider for your healthcare concerns.